Well, I've got right at our time. We're back on the air, ready to go, and really excited to have this amazing team from Luma walk us through their great solution. We've been really honored to have Luma as an industry partner since we started this program. And as you can see, their use case is really incredible. They have the teams from IU Health and the University of Arkansas Medical Sciences, really talking about their use cases at two very different institutions, but very similar goals. And so, Aditya, I'm going to turn it over to you to walk our audience through your great solution.
Perfect. Well, thank you so much, Elizabeth, for having us. Very excited to present today about from access best practices to going above and beyond, and what we can do as system leaders and health IT entrepreneurs and vendors and vendor partners to deliver better outcomes for patients. So I'm going to start with some quick introductions. My name is Aditya. You'll see a picture of me. I'm a lot less gray, probably about 15, 20 pounds lighter there. I'm one of the founders and CTO here at Luma. I'm joined by two incredible, thoughtful leaders. We'll get them a chance to say hello in a quick minute when they introduce their systems. 𝘁cie𝗽𝗰 Hanrahan, who is the Chief Clinical Access Officer. I'm the Associate Vice Chancellor for Access at the University of Arkansas for Medical School for Medical Sciences, and 𝘁cie Cromlich, who's a Senior Clinical Analyst on the Consumer Exchange team at Indiana University Health. So we're going to start I think, 𝘁cie, if you can give us a little bit of introduction, a little bit about IUH, and then we'll go to 𝘁cie thereafter.
Sure. So my name is 𝘁cie Cromlich. I am a senior clinical analyst here at Indiana University Health. I had the privilege of being the lead analyst on our Luma project to roll out these advanced reminders to our patients across our system. I am a nurse by background. I've been with our organization for 24 years, and I've been privileged to work with these solutions for quite some time now. With this project, we worked extremely close with our executive operational leadership just to ensure that we're really rolling out a solution to meet our patients' needs and the needs of our staff. At IU Health, for those of you not familiar with us, we are the largest network of providers within the state of Indiana. We have a number of hospital-based and ambulatory facilities across the state of Indiana as well, and we offer varying levels of care, including, care for adults and pediatrics. We have over 30,000 employees, over 3,200 active physician team members, and we provide over 2 million outpatient visits annually throughout our organization. We also have a strong partnership with the Indiana University School of Medicine, so we're deeply engaged with them when it comes to education and research. And our EHR system currently that we're on is Cerner, but we're pretty excited to transition in the near future to Epic as well.
Awesome. Thanks so much, 𝘁cie. Then I'll pass the baton over to 𝘁cie. Tell us a little bit about UAMS.
Thanks, Aditya. So my name, as we discussed earlier, is 𝘁cie𝗽𝗰 Hanrahan, and I am the Chief Clinical Access Officer here at UAMS. I started here in February of 2021 as in this unique role that didn't really exist before. And that is kind of when I got my first opportunity to choose Luma as our partner for all of our patient engagement, texting platforms, and we've just grown the partnership and the relationship over the last 3 years and have really accomplished some amazing things. One of the things that makes us really unique is we're the only academic medical center and the only level 1 trauma center in our state. We are we're the largest public employer with more than 10,000 employees, and in 73 of the 75 counties. We also have a huge economic impact to the state, to the number of 3.92 billion. We if anyone's not familiar with Arkansas, we're very rural. So we are the mothership main campus, UAMS Health, located in Little Rock. And then we have 8 regional program sites that are strategically placed throughout the state to help support the rural aspect of healthcare. But what that allows us to provide is internal medicine and family medicine. So we're really starting to think about how can we grow our reach in our specialty world, and how can we have Luma also be partners with us to help solution that.
Awesome. Thanks, 𝘁cie. And so for everyone who's not familiar with Luma, a little bit of a background on Luma. We were founded in 2015 with a very, very specific vision, very, very specific purpose, which is needing care is hard, being able to get care shouldn't be. And on that journey, we've built a set of solutions that are bucketed into access, communication, and readiness. So 3 key pillars that we see is how to make it easy for patients to get access to care when they need it. And we've delivered this set of solutions at over 600 different care institutions across the United States, from some of the largest IDNs and academic centers down to regional health systems and ambulatory-only practices. We integrate with all the largest EHRs, as you can see represented by both Indiana University and by UAMS, and then from there on down. And so when we think a lot about the world of access, one of the things that we wanted to kind of lean into is two case studies here today. One which we're going to present through Angie at IUH, and one which we'll present through Michelle from UAMS. And one of the things that in the IUH case study that I'll highlight and show a little kind of data around some of the work that we've done to kind of understand how care and how access is presented is really understanding how convenience of access, how consumerized access really starts to lean into making these capabilities around patient-friendly and patient-enabled self-service capabilities come into light. And so when we did some of our own primary research in the Cerner or Oracle Health market, I will never get those two names right. I don't know which one's which. I'll keep calling it Cerner. But 91% of Oracle organizations, see, I already messed it up. Oracle and Cerner health organizations lack any form of waitlist. This was from a survey that we did of about 130 health systems who operate Oracle Health. And what we found through that is just the ability to provide access to those health systems. And we saw Adrian talk about earlier as one of the pillars of the smart access strategy, that smart waitlists really do enable folks to be seen sooner and patients to get access to care a lot more quickly. So our own data, which is what we call Bedrock, which is our data asset, which is based on an analysis of 700 million patient interactions on the Luma platform over about 6 years of activity. Patients are often seen on average 21 days sooner. And these sort of key capabilities, these fundamental capabilities are instrumental and critical to providing great access. And so we're going to hand the mic back over to Angie to talk a little bit more about kind of what you were looking for in finding these solutions and how you made them happen and come to life at IU.
Yeah, so at IU Health, we do have that strong desire. We're constantly searching for innovative approaches to patient care that is obviously data-driven, and we'll talk about the data here in a little bit. And probably like most of us on the call today, we are always looking to empower the patient. We really want to meet the patient where they are, and providing solutions such as SMS messaging has really just proven to be successful in meeting those types of needs for our patients, especially as we've seen advances in technology and more wide use of those solutions. We also know that providing that really quick and easy access to conveniently manage appointments through channels like SMS does provide a great experience to our patients, but improving that speed of care has downstream impact. So if you consider one patient gets a reminder for an appointment, they can't make it and they cancel it, and in real time that goes to another patient and fills your slot for you, that's what we're seeing happen here and what we wanted to see happen. We also want to ensure that we are being equitable. We're maximizing our reach to our diverse patient population. And we know that SMS provides the best response rates, but even with that, we have the ability to utilize channels like voice and email. So we're still staying equitable there. We've seen gaps in technology with family-centered care, patients, adolescents, children, and this solution has helped support us there as well in filling those gaps. But again, filling that white space has really helped us reduce revenue loss, again, what we're looking for. And we were really looking to take advantage of automation, using that automation and let the systems do the work for us to reduce that administrative burden. So this is a screenshot of the reminder system and some of the solutions that we've been using. It's a nice glance of what the system has to offer. It's not exact verbiage to what we use, but this is a great snapshot. Our text-based reminders do offer the patient a general reminder of their upcoming appointment. We add some additional context, like we'll put in the address so the patient can tap that. It'll drive them right to the application on their phone that they use for their map links. So that's the first layer of this that we take advantage of. And then we get into what we call the advanced part of the reminders. The patient can interact with that reminder. We offer a confirm, a cancel, and a reschedule option for a lot of our appointment types. And what's really nice is this interacts with our EHR in real time. This keeps our clinicians in their native workflow. There is an application they can look into, the Luma application, but they can also stay within the EHR, and they can see when a patient has confirmed their appointment right there on the appointment in the EHR. They can also see that the slot was canceled and removed, making an opening for another patient. So that's the great thing about the integration. And then we do offer reschedule options, and that second gray slot that you'll see is one method that we offer those slots. We essentially have Luma read our schedules, and they create a pick list for the patient. We could give the patient a link to start picking and self-scheduling. This is a very, very easy and quick tap of one, and they pick their slot and they're ready to move on, very quick for them. And then the last one you're seeing is waitlist. We do offer waitlist again for many of our appointments, and the waitlist solution can help patients in many ways. It could be a patient who has an appointment in the future and they just want to get in sooner. This will help us get our patients in sooner. It could be a patient that's having trouble getting into a specialty. We just don't have an open slot. So we will get them on the wait list, and the solution will look for a slot for our patients and get them in when one becomes available. Next slide. And here's the data. So just to kind of high level talk about how many sites we have as well. We did pilot 30 ambulatory clinics in October of 23. And then in February of 24, we brought another 700 clinics live. And since then, we have brought over 1,000 clinic sites live on this solution. That includes ambulatory clinics, imaging sites, and testing sites. Not all of them utilize the waitlist feature, but those that do, we've seen upwards of 1,700 slots filled per month. And that's the system doing the work for us. We were manually managing these waitlists. I know some specialties in our pediatric space have patients upwards of 1,500 on those waitlists. So we're seeing high utilization there. If we use an average of $150 per appointment, we can see some significant revenue savings. And this is the automation of canceling appointments. So one patient cancels, the next patient gets an offer for that slot and takes it. And then we are mindful about the way we set things up. In our case, we don't just drop an appointment on a provider's schedule last minute. We won't drop an appointment on there for 24 hours before, because we know some appointments require prep time. But we do have a way to do same-day cancellations, and our primary cares and some of our specialties really use this, where a patient will call in the morning and cancel, and they can get an offer out for an appointment later in the day and get a patient in the same day. And this was something that we weren't really thinking of in the beginning, but we saw value pretty quickly in the project with this as well. Anecdotally, we've heard a lot of positive about the system as well, both from our staff and our patients, which is always nice data to throw in there.
That's always great to hear. Incredible results from IUH, kind of using patient-friendly and patient-forward thinking ways and consumer-friendly ways to actually engage patients, make those options available to them, and kind of respecting the fact that no patient, and this is lived experience as patients, your schedule's never fixed, right? Things change. Awesome.
Thank you.
One of the other things that we just wanted to make available for folks at the collaborative today was that not only is the work that we've done here with Angie and the team at Indiana University Health make work on Cerner and Oracle Health, but also we've done similar kind of things to actually enhance the utilization of FastPass, such as this example with Virtua Health, where we're able to take FastPass, which is Epic's kind of built-in waitlist solution, actually generate more utilization, providing more opportunities for access for patients. So across kind of the large academic EHRs, capabilities and functions that are available inside the Luma platform that make it very straightforward to increase the options for access and the availability of slots for patients. Next thing we're going to move on to is a case study from the University of Arkansas for medical sciences about really leveling up patient access from a very solid foundation. And so one of the things that we like to talk about, and I think Michelle will speak to this in a little bit as well, which is even with a digital front door, with all the tools that are available in the world for patients, the phone line often just is the front door. And being able to connect through that with powerful, seamless, easy to use tools and technologies is tantamount to providing all the best technological tools on the digital front door as well. And when we see in our data and when we analyze this information as well, we see that 34% of patients are more likely to reschedule and they're offered self-service. So not only do we see kind of empirically in kind of the data, but you can also feel this emotionally, given the options, given the availability, given the multiple and omni-channel routes to make this happen, people do in fact, and patients do in fact engage much more readily. Now UAMS has deployed a whole lot of these techniques and technologies. So I'll let Michelle speak to a little bit of the data in front of us before we get into the deeper of the case study.
Sure, thank you. So one of the things that we struggled with initially was a lot of the same day cancel or same day next day cancel, which was leaving open spots on our templates. So one of the things that we started to look into was those specialty service lines where we had long lag times and where we knew patients needed to be seen quickly, and how could we start to optimize that work. So endocrinology was one of our chosen service lines out of the gate. We had a huge no-show rate and nobody could really figure out why. So we started to offer them the ability to schedule patients and reschedule patients on their phones through the use of Luma. And one of the things that we implemented into this was, I think sometimes patients take it for granted, like, hey, I'll cancel my appointment today and I can get my next appointment in 2 days. I'm not going to have to wait. And we were very strategic in saying that if they requested to cancel, that, hey, our next available appointment is in 60 days, because legitimately that's what it was. So we saw a lot of people rethink that. So our no-show rate went down dramatically, but we also gave them the ability to reschedule. One thing from a leadership perspective that worried me a bit, and I think worried others specifically in the endocrinology world, was, are we going to have these serial reschedulers that are going to take up a new patient appointment and then just keep rescheduling and rescheduling and rescheduling and never showing up? And we did not have that phenomenon. And Luma has been able to provide us the data to let us know that 50%, if not more of the time when a patient reschedules, they do come to their appointment. So that was very heartwarming for me. And it took a lot of the pressure off with the service line. We generated about 138 million within 1 year with our patient self-scheduling, and then 38,000 revenue saved within 1 year by empowering the patients to reschedule via SMS. Aditya made a very good point. I'm not originally from the South, but I feel like the South are very friendly and they're very hospitable and they love to talk on the phone. So for us, a lot of our primary means of communication with our patients is through the phone. So we really wanted to optimize and give everybody an option for what they wanted to do by phone, by text, by email, by voicemail. And that's been impactful for us.
Perfect segue. So Michelle and the UAMS team built kind of this basic foundation upon which, great access, great outcomes all come together, but they're ready to level up. And one of the new products that Luma announced at our Luminate, our annual customer conference last week, is called Navigator, which is an omni-channel, multimodal, context-aware, zero retention AI solution in order to connect patients at all points of the care journey, whether they're coming in through the phone call with AI agents speaking under very specific circumstances or via text. University of Arkansas was one of our launch partners, and they co-developed the solution with us. And just to give you a little visual before we hand the mic back to Michelle to round us out home, this is kind of exactly the story we like to tell, which is no matter which entry point you're coming into, digital, text, or phone, context aware, fully aware of the prior conversations that have happened is kind of the key to what makes Navigator very, very special. And along with the deep integration that we have with University of Arkansas's UAMS's EHR, which is Epic. Putting these two things together enables some really, really incredible results within just the first month of our deployment together.
So we had some great outcomes. One of the things that we were trying to solution for, our call center isn't 24/7 and it's not open on weekends. So after hours, you run the chance of someone calling and needing to schedule or cancel an appointment. So what our current practice was before we came up with this brilliant idea and worked with Luma to kind of bring it to fruition was a patient called, they got a voicemail, and then my team of agents would come in the morning, and some days they'd spend an hour and a half to 2, 3, 4 hours going through this list and getting canceling patients in the system. As you can imagine, if it was at 8 a.m. that canceled and we didn't get that call till 7:30 and didn't get it canceled, it was a no-show. So providers were unhappy and the team was just spending hours and hours of work, which was just kind of insane to me. So we implemented the Navigator, And we utilize the Navigator now is the point of entry for our patients to call in and cancel their appointments. So we save 98 hours of work in the call center within the first month. 95% of our calls are automated. 82% of those callers that came in, we were able to verify as the correct current patients. And we did 1,200 cancellations, which probably isn't great, but we did it without manual calls. So, I mean, it completely revolutionized one aspect of the work that was such an impact, positive impact to our agents, that like Luma is the holy grail in our call center. So they are very excited by the amount of time that was saved.
I couldn't have come up with a better close for our section than that, Michelle, as much as I would have tried. Well, Angie, Michelle, thank you so much for sharing your stories with us. If you want to learn anything more about what we do or the stories that Indiana University or UAMS shared, there's the LinkedIn links. We're happy to chat more on either of these, but really appreciate the opportunity, Elizabeth, to share the stories of our partners with the collaborative.
I love it. And going back to the smart access from the beginning of our showcase, really thinking about, the business that we're in is patients. It's also ourselves, and really making this work better for ourselves too. Our teams are frustrated by the environment. And so just really exciting. Michelle, I loved your closing remark about really being able to hit that home run with your Access Center team. Absolutely great presentation. And so we'll have maybe the great folks from Luma hang on for a hot second to answer any questions in the chat. Feel free to be able to, any questions or thoughts that you guys have. And if you guys can just hang on and again, just answer any questions in the chat, that would be awesome as we move on to our next speaker. Thank you so much for the great team from Luma. We had Angie from IU Health, Michelle from UAMS, and Aditya from Luma. Wonderful presentation, really showing the breadth and depth of the solution at Luma.